Officials in Mali say a nurse infected with the Ebola virus has died. This is the second death linked to Ebola in the country after a 2-year-old girl died last month. Officials say the nurse treated a man they believe also died after contracting Ebola. She worked at a clinic in the capital, Bamako, and now the clinic has been put under quarantine. Mali borders Guinea, where the Ebola outbreak began last year. More than 400 health workers at the only Ebola treatment center in southern Sierra Leone went on strike on Wednesday. A representative of the striking workers, Mohamed Mbawa, says the government has not paid risk allowances since September, and he also says the strike will continue until workers have been fully reimbursed. The clinic in Banda Juma has about 60 beds for Ebola patients. UN officials warn that the number of Ebola cases is surging in Sierra Leone due to a lack of treatment centers. So far, the government has not commented. And a project taken on by 11 graduate students at Texas A&M University's School of Architecture to design light, durable, and quickly deployable Ebola clinics recently attracted worldwide interest. As VOA's Greg Flakus reports, the students came up with a variety of creative and practical solutions to the problem.
Architecture graduate students usually work on projects like the one shown in this model, contemplating large buildings and landscaping. But a few months ago, their class was given the challenge of designing clinics to treat Ebola in Africa. Texas A&M University Architecture School Dean Jorge Vanegas says they had to think light and portable.
Something quick, modular, deployable that could actually satisfy a given program.
Celso Rojas concentrated on panels of aluminum, wood, foam insulation, and plastic that can be quickly connected together on site.
The other aspect of using this panel is since it is modular, if it is beyond the point where you can disinfect it, you can just replace it with a new piece.
His friend, Iranian-born Sohail Hamida, designed an accordion-like flexible structure.
We can fold it, put it in a container, put the container in a cargo, and then transport it to the site, having it expanded as long as we want.
Godi Nakardi, from India, uses the shipping containers themselves as part of the structure.
So I have like a double shell, so my inner shell would be like the plastic, the high-strength plastic. It's easier to desterilize and decontaminate, while the outer material can be the shipping container, which holds the weight of the people inside the module.
Shetsi Leiyu, from China, came up with an easily transportable unit that can be set up by pumping in air.
So this is my design. I use inflatable structure to support the whole unit.
Their professor, George Mann, says the Ebola crisis in Africa has created a high demand for such a clinic, which is not yet actually available.
As of now, these are simply ideas, and we hope that it can get to realization quickly.
Mann says the next step is to incorporate ideas from these designs into a prototype for testing. Up until now, architects have designed hospitals for treating a variety of illnesses and injuries, but Mann says highly infectious Ebola is different.
What we're suggesting by these is locating them in a remote place, self-sufficient, away from taking down a hospital and the personnel.
He also sees a problem beyond Ebola, as researchers struggle with microorganisms that have mutated and become harder to fight.
If diseases continue to become antibiotic resistant, all our health facilities will have to be rethought in a fundamental way.
So for architecture students, there may be even more ambitious projects to come. Greg Flakus, VOA News, College Station, Texas.